Welcome to the Empowered Endings podcast, where you will learn how to navigate the complexities of palliative and end-of-life care in new ways. Your hosts, Dr. Bob and Elizabeth Uslander, have decades of experience raising the bar in palliative care and family support. Join us as we explore the wonders and realities of palliative care, share powerful stories, introduce you to amazing people that we've cared for, and empower you to navigate life's final stages with more grace, dignity, and ease. Together, let's discover empowered end-of-life experiences. Welcome to the first episode of our podcast. In this episode, we will introduce ourselves, the founders of Empowered Endings, and share the life journeys that brought us together to do this important work.
All right, so here we are.
Here we are. I'm so excited to talk about empowered end-of-life experiences with you. We've been wanting to do this for a long time.
Yeah, no, we've been talking about empowered end-of-life experiences for many years. We've been talking about getting this podcast started for a number of years. And I'm excited. You know, my feeling is if there were recordings of all the conversations we've had over the years with ourselves and with people, we wouldn't really need to do any more recording because so much of it has been said.
That's true.
But here we go. We have an opportunity to start fresh and really share everything that's coming and what we've created and what we're hoping for and envisioning. And so I'm excited.
I'm excited too. I think it'll be a lot of fun to talk about how everything that we have experienced has sort of come together in this really crystallized and beautiful way, both through the things that we've been through and through the things that we're envisioning, co-creating. And I think all of it together is it's a pretty cool journey.
Yeah. Well, we should maybe share the journey a little bit. I think it'd be cool for us each to talk a little bit about where we've been in, how we've gotten to where we are now, both kind of individually and together. And I know I love listening to your story, so would you mind starting?
I would be happy to. I think one of the things that's really interesting about our individual journeys, our collective journey, and everyone that we've spoken to is how powerful the life story is in the moment that we meet ourselves, each other, and all of the people that we support in their palliative care and end-of-life journeys. So as I'm sharing my story, I'm conscious that I've learned a lot from the people that we've walked with through their journeys and how the ways in which we live really influence the ways in which we die, and how our legacy lives on in the loved ones who carry on our memory. So thinking about it from that perspective, I grew up in Washington, D.C. in a really diverse, magnificently richly diverse community, and learned from a really young age the importance of dignity and agency in life. I befriended a couple of gentlemen that lived on the block that I grew up on, unhoused, and magnificent human beings who mentored and befriended me in my youth and helped guide me in understanding what was really important in life. And that, combined with a lifelong passion for studying and experiencing spirituality, spiritual practices, different ancient traditions and philosophies, and how they can be integrated into our lived choices, became a really solid foundation for my unbelievable commitment to honoring dignity and choice and agency in every aspect of the human experience. My career was a bit all over the place. I worked in public school education. I worked in nonprofits. I worked with NGOs. I worked in the government. I went to seminary thinking I was going to go into the ministry. I did a lot of multicultural work in each of those different fields and spent a lot of time working with people who were struggling with getting what they needed from the system, whether it was the system of community resourcing support or the healthcare system or the education system. And, you know, as a child, I had this incredible idea that I wanted to change the world. I wanted to make the world a better place. I wanted to make sure that everybody had dignity and agency in life. And I just wanted to make sure that everything was spectacular for all humans. And as I kept working in the world, I kept discovering that it was actually really hard to do that, because the systems were really not built for that. The systems seemed to be really built for themselves. And I increasingly experienced frustration, and that's part of why I changed tracks so many times. I thought, well, if I can't do it here, maybe I can do it there, so I'll try over here. And if I can't do it here, maybe I can do it there, so I'll try over there. And eventually I ended up in the healthcare system after studying spiritual care for many, many, many years, and then going into clinical social work. The intersection of spiritual care and social work brought me to palliative and end-of-life care. And in particular, my health law and policy research brought me to focus on end-of-life options and the impact that end-of-life options have on empowering patients and families in their journeys for those for whom that's the right choice. And that's how I ended up in hospice and palliative care. That's how I ended up finding my way to supporting patients and families in their terminal and complex illness journeys. And I would say that a lot of my experience, not only professional, comes from personal journeys that I've had along the way in my own really complex healthcare journey. I, also experienced personally all of the gaps in the healthcare system, the struggles with getting the right support, the right doctors, the right diagnoses, the right treatments, battling back from the wrong treatments and dealing with the negative impact of the wrong diagnoses. And then also my own grief journey. So, as you know, when my daughter was 9 years old, her father died tragically in a car accident. And although I had studied bereavement care in seminary and would later study it more in my social work degree, I really was crushed like a diamond in that grief journey. And I've since, as you know, lost a number of other very, very close friends. So, and family members. Half of my wedding party is gone from this world, and the closest people in my life for many years are somewhere else. So I think having that really deep personal loss in so many different ways, car accidents, cancer, all kinds of things, has really helped inform my understanding of what's important, not just for me, but for other people. For the children who are part of the journeys of loss, for the family members who are supporting someone going through that tragedy, and in particular for the patients who really need and deserve more than the medical system is inclined to offer. How about you?
Well, before I just wanted to comment. I know your story clearly. I'm very aware, but when I hear it, I just am so struck by how life has shaped you and guided you towards where you are now, and you are in the exact place that you belong, and you are the exact person who's designed through all of these experiences, through all of these, both tragedies and celebrations and all of it, to be in the position to be helping to build and expand awareness and inspire people to think and behave differently, and to advocate, learn to advocate better for themselves and their loved ones through this messy, crazy, journey of life and illness and ultimately death. So
Thank you.
I'm
Yeah.
I'm extremely excited and thrilled to be your partner in all of it.
Thank you. I appreciate that. I definitely feel like I've been sort of batted around a bit, and it's all been for some good purpose, has, like you said, shaped me into the person that I am today, and that's exactly who I'm supposed to be. So it's been a beautiful, like, blessed and also very challenging road. And I think that's part of what, the space that we're working in, the thing that we're talking about is how do you have an empowered end of life experience? End of life journeys can be hard, scary, fraught with challenges. They're very delicate. They're dynamic. People's lives are changing rapidly. The impact is substantial. They may or may not have all the resources and information they need. And how do you make that something beautiful? How do you help make sure that people feel that sense of beauty and blessing instead of the struggle and suffering? So I would love to hear your story today and how you found your way to here where we are.
Well, I think like you, it was a circuitous, windy path that I could not have known or chosen. It was unknown to me, and I believe that I have been placed here similarly by the forces of the universe that are guiding us all. So I was born and raised in the suburbs of Chicago, and I did not have a terribly international, diverse experience growing up. I was fairly sheltered, and I think a bit naive about what was true in other parts of the world. I was I ultimately finished high school, went to college in Champaign, University of Illinois in Champaign, and then I found my way out to the West Coast, where I went to medical school at UCLA. And my choice of becoming a physician was it wasn't kind of straight. It was ultimately I found my way there after studying a few different things in college, and then I was fortunate. I had a couple of friends who were pre-med students, and I started spending more time with them, and I started taking some science classes and exploring what life could be like as a physician. And this was in the early 80s, and before HMOs, before the AIDS epidemic, before things really changed and shifted in the healthcare world. And it was a really good time to be going into medicine. I ultimately became trained as an ER physician and went back to Chicago for my residency in emergency medicine, and that was wonderful. I loved being an ER doctor. I loved all of the variety and the tensity, and being like in charge, running an emergency department, having 30 different things that I had to be paying attention to, and the adrenaline of it all. And as I started maturing as a physician and as a person, I started noticing some things that were happening in healthcare and right in front of me that were really disturbing. And one of them was the way that we were as a society ignoring the needs of the elderly and kind of pushing them aside. Or when they came into the emergency room, they almost became like a commodity. Everyone, there was no focus on the individual, on the person, the human being that was being attended to and needing care. And they were sort of just put through on a conveyor belt of testing and consulting and admissions and being sent to nursing homes. And there was really no one was paying attention to what was best for that person, what their quality of life was like. And the conversations just weren't happening, and their families were completely distraught and also unattended to. And that just planted I was starting to notice this, and increasingly, and spending more time with the older patients that were coming, I would just pull up a chair and sit at their bedside and just learn about them and talk with them and hold their hands and make sure they didn't feel so alone, really. I remember nurses would like be out there trying to find me because things needed to be done, and they like find me sitting there with, this old gentleman talking about his medals from World War II, and so I just started getting forming a deeper connection and realizing that this was something important was missing. And then I had an experience, as you're well aware, with a friend who died of melanoma at the age of 32. So he wasn't an older person. He was a young, vibrant person, but he developed metastatic malignant melanoma that quickly tore through his body, and he was terminally ill, and was a 32-year-old with three little boys under the age of 6 and a wife, and they were completely blindsided. They had no idea what was happening or what to do. And as a friend, I came and started, meeting with them and finding support, and got them on hospice and had my first exposure to hospice care, which was fascinating. And I'd never seen that kind of care being delivered to somebody. And it was a beautiful, beautiful experience to being able to guide and support and almost sort of Sherpa alongside my friend Darren and Rhonda. And he died on September 14th, 2001, 3 days after 9/11. And that planted a seed within me that kind of helped to inform and inspire the rest of my journey. Started a house call practice for homebound seniors. I started a home care company to provide additional support for people in their homes. I helped to create a adult day health center for people with dementia. And just bit by bit, I found myself finding ways to fill some of the gaps in the communities that I was, living in. And I came down to San Diego in 2011, and I continued to commute several hours to go work in the emergency room while I was finding my way forward in the next path, the next part of my journey. And then I had a very clear, I think I call it a download from the universe, or an epiphany, where I actually heard internally within my body the words, "You're here to help people die better." And from that moment on, my path has been singularly directed towards finding ways to help people experience a more gentle final chapter of life, starting upstream from where they first get diagnosed with a condition, or even earlier, where they're trying to plan for their ultimate, endpoint, and then caring for people through their challenging, complex illness and leading up to the time of their death. And I've done it, and I worked with a traditional hospice company for a couple of years and became very frustrated and dismayed at the gaps that existed in that care. And in 2016 started our practice, which has been devoted to providing this higher level of care and support for people dealing with complex and terminal illnesses. And it's been nothing short of magnificent. And our partnership has gotten us to this point where we are looking at expanding our model throughout California and ultimately throughout the country. And we have this incredibly beautiful foundation that is poised and ready to really provide enormous benefit to people and on many fronts that we'll be able to share with everyone through this podcast. So here we are.
Thank you for sharing your story. I've heard it, as you know, many, many times, but I always love the nuances that show up each time, and what, you focus on what feels particularly poignant to you any given day about the journey that you've been on and how you got to where you are. As you were talking, a couple of things came to mind. One of the things was the experience you had of being really present with your patients is something that I think is particularly poignant about both the work that we do and the impact that we have, and what is, broadly speaking, missing from every kind of care, clinical care, whether it's in the hospital, in the ER, or, at your doctor's office. They're trying to go through all the patients that they have on the docket for the day, and the ability to just really be with people, to almost get lost to your staff because you're so invested in being present with and learning about the life of the person that is a patient. There's someone you're technically treating. There's someone you're professionally serving, but your ability to be with them as you do that is extraordinary, and I think really poignant. And the term Sherpa that you used, of like walking with people through these stages, it's not just the dying, right, that matters. It's everything leading up to it. It's all of the living that happens before the dying moment and after. And it's not just the patients, it's the families, and the ability to be present in that walking with you way is something that I think it transforms lives. It changes the experience completely, because the condition is still the condition, right? The circumstance is still the circumstance. If someone is sick or dying or struggling in some way that's not curable, the role of the healer is not to resolve that circumstance. The role of the healer is to make that a circumstance that is not frightening and frustrating, but one that can be met with that gentle grace and connection and sense of safety and security, and having been seen and heard and held and made whole through the journey. And I think that the something that just really stands out to me in everything that we do and everything that we talk about in terms of empowering people's journeys is the system is built around treating a disease, the medical system, the healthcare system, and it's consumed by insurance and bottom lines and the structures that are driving it and supporting it. But the people need connection and care. And it seems like medicine has moved away from genuine healing to really just treating and treating and treating and testing and treating. And I think that the ways in which you as a physician have shown up in the patients and families' lives that we've supported, that I've personally witnessed, really reflect that grounding in being a healing presence, as opposed to what else might be available through the medical system.
Yeah, the healing is the key. We're all about healing, even though that might not mean saving or curing. Healing is a much broader, holistic approach, and a lot of what we're healing isn't just focused on the patient. It's focused on their loved ones, on the relationships, on the misunderstandings. Sometimes it involves healing the angst of the healthcare providers that are part of their team, by making sure that these gaps are being filled, and that they're not watching helplessly as their patients and families struggle because they work in a system that can't meet their needs. And so we've seen a lot, we've been through a lot, we have, and then we're just kind of using those experiences as tools to serve and help heal individuals, systems, and ultimately heal part of society in changing the conversations around end of life, changing the conversations around what's possible, helping people understand that they have more agency then they know that they have more options than they're aware of.
In the next episode, we will share our experience exploring the final stages of life, in particular, opening conversations about taboo topics like how to create an empowered ending.
Thank you for joining us today. We hope you found this episode to be valuable. Having tough conversations about how you want to experience the end of life is so important. And please share this podcast with someone you know who needs to hear it. We're all in this together. For more resources and support, please visit empoweredendings.com. Until next time, remember that every ending can and should be an empowered one.